What is trauma? Trauma is the response to a deeply distressing or disturbing event that overwhelms an individual's ability to cope, causes feelings of helplessness, diminishes their sense of self and their ability to feel a full range of emotions and experiences. Trauma can cause feelings of depression. While there are no objective criteria to evaluate which events will cause post-trauma symptoms, circumstances typically involve the loss of control, betrayal, abuse of power, helplessness, pain, confusion, and loss. Traumatic situations that cause post-trauma symptoms vary quite dramatically from person to person. Indeed, it is very subjective, and it is important to bear in mind that it is defined more by its response than its trigger. The word triggered has become a popular term to describe anything that causes emotional discomfort. But for people who have experienced trauma, triggers can be terrifying, all-consuming, and can seemingly come out of nowhere. Trauma triggers can be anything that reminds you of a past trauma, which might include a certain smell, a particular song or sound, or a piece of clothing. Trauma is known to have a long-lasting and repetitive effect on our minds. However, there is hope for those who experience trauma's after effects. In order to overcome triggers and depression, we advise that you seek out a therapist. Therapy provides a safe and confidential place for a person to talk to a professional about personal experiences, thoughts, feelings, or problems. The role of the therapist is to help the person understand his or her situation, teach strategies to express him or herself, and how to cope with potentially stressful situations. The therapist can also offer the individual or family tools to help them manage difficult feelings and negative thoughts and behaviors. It is important to find a therapist who has experience in helping people with severe traumatic histories work through their painful memories. Trauma therapists and trauma counselors are compassionate, empathetic, and understand that real trauma takes time to heal from. They are patient with their clients and help them as much as they can. In order to treat child trauma, it is critical that you seek professional treatment for help. They will help you cope with these issues and learn effective techniques for dealing with them. Acknowledging these issues can be difficult, but it is important that you find help for them to treat them and prevent them from growing worse. Research evidence shows that childhood trauma, if left untreated, can cause a multitude of mental health conditions throughout early and mid-adulthood. In conclusion, you must remember that everyone heals at their own pace. Healing takes time, and there is no rush at all. We are the Anderson System. Please remember to like and subscribe. Thank you once again, friend.